My name is Keith Saxon. I'm the lifestyle lift physician in Kansas City, or more specifically, Overland Park, Kansas. I did my first facelift in 1978 at the University of Michigan, where I did my head and neck surgery training. I scrubbed with one of the most preeminent plastic surgeons there, and of course when you're starting out you don't do the procedure, you assist, and so that was my first taste of a facelift and what the rest of my life might look like. I started thinking about being a doctor when I was in elementary school. I remember the exact day walking home from 6th grade in New York's, a suburb of New York called White Plains, and being so excited because I had figured out what I was going to do with my life. Facial plastic surgery is less about the operation than the transformation we can bring to patients. Throughout my career, which has included research and trauma and head and neck tumors, I've had grateful patients for the results they've had. None of them wanted to be there, but we got the job done and they were happy. When I have facial plastics patients, when I do a facelift and neck lift and the various other procedures we perform, I have ecstatic patients. I have patients who tell me their life is changed. And even now as I'm talking about it, I get goosebumps. That's the deal for me. I knew about lifestyle lift actually, I think at its very beginnings, because I was in the business and it was like, gosh, I wish somebody would just bring me patients. At Lifestyle Lift, for me, it's the job of a lifetime. It's the perfect job for a surgeon like me who just loves to operate. I was a performer. I started working and getting paid for it when I was 15. I lived in New York. Cabaret laws are different, lots of opportunities. Through doing cabaret, in order to hold on a job, it was demanded of me that I take dance lessons, and I was actually okay at it. Mostly back then it was, if you were a guy and you would wear tights, yeah, you could work. I continued in music and performing arts. In fact, I think many people may not know that I spent 19 years on the University of Michigan School of Music faculty in performing arts medicine. Another love, but I think completely of the same cloth of plastic surgery. It's all aesthetics. I like to think that I have a connection with most all the patients that I operate on. And that connection is probably strongest in our first meetings and through the operating room. But that some little parts of me have to go out the door with them. I learned early on that every medical decision, every decision has to be made asking the question, what's right for the patient? And that's the rules to live by.